Testing!
This is our presentation on Addison's disease by myself, Brittany Fandel, Kristen Greeby, and Rose Waters. Addison's disease, also called primary adrenal insufficiency, is an uncommon disorder that occurs when your body doesn't produce enough of certain hormones. This disease most often is due to autoimmunity, but can also be caused by infections like tuberculosis. In this disease, the immune system attacks the adrenal glands, causing an imbalance of hormones. The outside layer of your adrenal glands make the hormones that regulate blood pressure, salt concentration, and water. They also respond to stress signals. The immune system attacks the outer portion of the adrenal glands, in which the zona fasciculata secretes cortisol, while the zona glomerulosa secretes aldosterone. Aldosterone helps control blood pressure and balances the levels of sodium and potassium. Cortisol, along with the adrenaline and noradrenaline, regulates the stress response. The two adrenal glands in the body, one on top of each kidney. The inner adrenal cortex produces other hormones like adrenaline and noradrenaline. The outer adrenal cortex is responsible for producing steroid hormones called corticosteroids. Glucocorticoids is a type of corticosteroid that includes cortisol and plays a role in energy conservation, inflammatory response, and stress response. There are also mineral corticoids that include aldosterone. Finally, there are androgens that regulate sexual development. Mutations in the family of genes known as the human leukocyte antigen complex often cause autoimmune Addison's disease. The HLA complex helps the body distinguish its own proteins from foreign pathogens. A mutation in the HLA DRB1 gene is a well-known risk factor for this disease. A combination of this mutation and other mutations in the HLA gene may lead to the overresponse of the immune system seen in this disease. The immune response in Addison's is triggered by a protein called 21-hydroxylase. Normally, this protein assists the adrenal gland in producing specific hormones. The prolonged immune attack triggered by 21-hydroxylase damages the outer layer of adrenal glands known as the adrenal cortex. This prevents hormone production of cortisol and aldosterone. A shortage of adrenal hormones disrupts several normal functions in the body, leading to hyperglycemia, hyponatremia, hypotension, muscle cramps, and other features of autoimmune Addison's disease. Antibodies that react with the 21-hydroxylase are present in about 86% of patients with Addison's disease. These anti-21-hydroxylase autoantibodies are therefore markers of autoimmune Addison's disease.
The symptoms of Addison's disease include muscle weakness, weight loss, fatigue with increasing severity, patchy or dark skin, or low blood pressure. These can vary from person to person. Some symptoms develop slowly over time, while others develop rapidly, usually during acute adrenal failure. Many of the symptoms are nonspecific, so they are common to many conditions. Symptoms don't occur until 90% of the adrenal cortex is destroyed. Fatigue is one of the most common symptoms. Hyperpigmentation is also common, which is the dark patches of skin. It occurs mostly near scars, skin creases, and mucous membranes. Sometimes the hyperpigmentation can precede other symptoms by even months or years. Vitiligo is the development of skin abnormalities that are white patches or black freckles. Some gastrointestinal symptoms are common, including vomiting, nausea, diarrhea, and abdominal pain. This leads to unintentional weight loss that can progress the fatigue and muscle weakness. Dehydration is also common from diarrhea and vomiting. The low blood pressure leads to dizziness and lightheadedness. This can lead to syncope and changes with behavior and emotions. The entire disease is linked to irritability, depression, and poor concentration. Other symptoms are low blood pressure, low blood sugar, and a craving for salty foods due to a loss of solutes. Women can experience irregular menstrual periods, a loss of sexual drive, and a loss of body hair. When symptoms occur suddenly, it is known as acute adrenal failure or an Addisonian crisis. When this occurs, individuals experience loss of strength, severe pain throughout their lower backs, abdomens, and legs, low blood pressure, loss of consciousness or syncope, or vomiting and diarrhea that may lead to dehydration. This is a life-threatening and could lead to shock or kidney failure. Acute adrenal failure is usually catalyzed by an additional factor such as trauma, surgery, or a severe infection. The levels of cortisol in this response are 2 to 3 times less than they should be due to the insufficient production by the adrenal glands. 75% of primary adrenal insufficiency is caused by an autoimmune reaction, in which the natural immune system defenses attack healthy cells. It can occur by itself or be a part of the autoimmune polyendocrine syndromes 1, APS type 1, and 2, or Schmidt syndrome. Tuberculosis used to be a major cause, and it's still a major cause in developing countries where tuberculosis is still common. Other causes are less common are fungal infections, cancer as it spreads from another part of the body to the adrenal glands, hemorrhaging in the adrenal gland, and amyloidosis, which is the accumulation of fat substances in the adrenals. Cortisol is important for how humans respond to stress. These levels can increase under stress. It's also used to maintain blood pressure and cardiovascular function, control blood sugar by balancing insulin, regulating water, and assisting in the metabolism of fats, proteins, and carbohydrates. Aldosterone maintains electrolyte balance via sodium and potassium. This maintains water levels, which in turn affect blood pressure and blood volume. A deficiency in aldosterone can impair the kidney in its function of filtering salt and water. This can result in low blood pressure. Androgen is also produced by the adrenal glands, which controls secondary sexual characteristics. A lack of androgen can cause a diminished sex drive in women and a loss of body hair. Males don't experience this lack of androgen because their androgen is produced in the testes instead of the adrenal glands.
Low sodium levels or hyponatremia, or high potassium levels, also known as hyperkalemia, is often seen in patients with this disease. Hypoglycemia can occur, but it's uncommon. Adrenal calcification, or the accumulation of calcium in the adrenal glands, and adrenal enlargement can be seen in cases of Addison's disease associated with tuberculosis. The picture shows what adrenal calcification would look like in radiology. Addison's disease occurs in all age groups and both sexes and can be life-threatening. Research has shown that some people with certain genes are more likely to develop autoimmune disorders, such as Addison's. There is some research that shows that Addison's disease can be inherited and may be caused by genetic predisposition. The data suggests that some people do not express the disease, and environmental factors may need to be present in order to trigger the disease. It's not clear how these diseases lead to Addison's disease and similar conditions, but it does mean your risk of developing Addison's disease is increased if you or a close family member have another autoimmune condition such as vitiligo, which we described before, type 1 diabetes, or a long-term condition caused by your body not producing insulin, or underactive thyroid gland known as hypothyroidism. The treatments for Addison's involve different forms of medication. Hormone replacement therapy is used to replace the hormones the body is not making. Oral corticosteroids like hydrocortisone, prednisone or methylprednisolone are given to replace cortisol for the rest of the patient's life. In most cases, hydrocortisone is given. These hormones are given on a set schedule to mimic the rise and fall of cortisone that normally would occur in the body. Fludrocortisone acetate can also be given to replace the missing aldosterone. Care should be taken to ensure enough sodium is received from the diet. Injections of corticosteroids may also be required if the patient is not reabsorbing their medications due to illnesses or problems like diarrhea. The picture shows the similarities between the missing hormones in Addison's disease, the aldosterone and cortisol, to the treatments of hydrocortisone and prednisone. Notice the cortisol and hydrocortisone are exactly the same structure, and aldosterone and prednisone are similar in structure. In general, the treatments for Addison's disease do not have side effects unless the dosage is high. If the dosage is too high, if high doses are taken, there are risks of weakened bones called osteoporosis, mood swings, and difficulty sleeping or insomnia. All right, these are the questions that we came up with from our presentation, and I hope you enjoyed. These are our references.
Thank you.